You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. Hey everybody, Doc Teams here with the NeuroRESET podcast. Today, I actually just want to give you my story. Why I do what I do, why we're doing the rehab and all the different types of techniques that we're doing here, and just my health story, what led me this way. Looking back, I was always trying to help people, kids falling off their bike, help them out, continue with whatever race it was, like a little BMX thing. And I would just go, I know it's in my nature to just keep going. And so that ultimately led me to becoming a personal trainer. I started working with clients that really, it was all about function, right? It was almost never about weight loss. Weight loss was really a byproduct of the work that we were doing. 20 years ago, when we were really talking about nutrition and things like that, it was not what we're knowing today. You try to get the, say a 20% protein, 10% fat, maybe a 40, 60, 80% carbohydrate intake. We just know that that's not accurate for proper physiology. Now we're talking ketogenic, Mediterranean, paleo, intermittent fasting, or constant fasting, right? You've got your bulletproof coffees, you've got all sorts of supplementation that are available now that weren't available then. And all of it really has a time and a place, but things were different 20 years ago. And what I find is generally we just need to do the basics, right? In terms of basic nutrition, eliminating inflammatory foods, all sorts of things. And so back to what I was focusing on was always function, right? And now we focus on here at the office is function of the spine and function of the nervous system, namely the nervous system. The nervous system controls all of our spinal muscles. It controls our gait. It controls our balance. It controls our coordination. It controls our focus and attention. It controls everything. It makes sure that we sleep, makes sure that we wake, all sorts of things, right? And so as I'm working through this personal training career, did this for about 5 years, and it was always trying to get these people to accomplish what they couldn't accomplish, right? It was always about the outcome, the end result, as opposed to weight loss. And that's really what I was able to do. That helped really catapult me towards how can I do this better? How can I do this at a higher level? How can I make a physical change with my hands? And that was really interesting. I would work out with people maybe twice a week. That was probably the average. And I know that probably 80% of them didn't do anything outside of those 2 days a week. So my thoughts were, hey, maybe chiropractic can push somebody over the edge and help them for longer than just a 24-hour period. Maybe this adjustment can help them for weeks at a time, maybe for longer than that. And so I went into chiropractic school very naive, thinking that I could just simply do an adjustment and then they would work out, or I could help them work out and all would be great. Well, interestingly enough, when I get there, my roommates who are actually on the podcast at some point, they were all into the neurology program. And so here I am, this newcomer who has a personal training background. I've been adjusted maybe 2 times before chiropractic school, and honestly, it was an awful experience. I think I went to 2 different chiropractors, and both were terrible. So I understand when people don't have good experiences at the chiropractor. I understand. And so we're very clear and deliberate about what we're going to be doing, and we have a lot of different options for people, so we don't have to do the typical chiropractic stuff. Anyway, I get to chiropractic school, and what I find is most of my instructors can't answer the questions as to why does adjustment work for someone over here, but it doesn't work for someone over there, but they both have the same complaint. That's what really fascinated me. So it tells me that this goes deeper into the system. There's also a story of Harvey Lillard, right? And so the story of Harvey Lillard, long story short, is he was the janitor for one of the Palmers who basically developed chiropractic. He said that he had lost his hearing in one ear, and one of the Palmer brothers said, hey, I'm just going to push this bone in the middle of your back, and he popped the bone in his back, and his hearing came back. Well, what's interesting about that, when you really look at it, there's no single nerve that goes from the middle of the back up to the ear, either ear. And so there has to be a relationship between those two that is kind of under the surface, so to speak. And that's where the nervous system comes in, right? The neuro part of the reset. And when I got to school, I started seeing these things and asking why, right? This is kind of where the research side of me, I have to see it and take it, and then I run with it. And so I kept asking why from my instructors. And a lot of them just said, you know what? I'm not really sure. Just go ahead and adjust them and see what happens. I'm like, well, I think I need to know a little bit more than that. And sure enough, turns out I moved into a house with another student, and he ended up being in my wedding. He was one of my best men. Actually, both my roommates from chiropractic school were in my wedding. And ultimately, they were in the neuro program. And so I ended up joining in. I was that young kid the first year that was really just trying to get involved, thinking I know stuff, asking all the questions. Meanwhile, they're like at another level trying to learn different stuff than I was able to learn. Well, that kind of lit a fire underneath me. And ultimately, I ended up, I would love to say surpassing them, but I caught up real quick. And in about a 6-month time span, I went from knowing nothing to actually running the neuro club in class there or at the school. And we grew it to the point where other doctors from outside of the school were actually coming in to learn about neurology. I was actually contracted to help teach other doctors in their offices how to perform neurology. And so that was really a turning point in my career, really while I was in school, realizing that I had a skill set that could help a ton of people, especially when all these doctors are saying, dude, this is awesome. I never had the ability to do this. You are going to go so far with this and be able to help so many people. And that's really what we're doing. So let me take you a little further back why I ended up in chiropractic in the first place. So when I was in, call it undergrad, I was actually competing in long drive, so a golf competition where you basically hit the ball as far as humanly possible. So my longest drive was 375 yards into the wind. It was within the hash marks, and I ended up winning the competition. So that was amazing. That was back when I was like 22, but I had a lumbar fracture earlier in life that prevented me from continuing to do it, because it would become so painful that I couldn't continue to perform. And so that's what ultimately led me to getting into what I'm doing today, being adjusted for my neurology, utilizing non-surgical spinal decompression, and really taking my own care to the next level. So going back even further into like, say, middle school, I was a baseball player. I was just starting to golf at that time, but as a baseball player, I seemed to be always accident prone. I was always hurt, right? My neurology at that time was not optimized, and I just kept going, didn't give my body a rest, and I paid the price. So what happened was I was in a summer retreat for, it's like a week-long program, call it a camp for baseball, up in the lovely mountains of Telluride, Colorado. And the first day we ran a scrimmage, and I ended up fracturing my spine. Okay, it's called a pars fracture. If we have basically the vertebrae here, for those of you that are watching, the two bones that open up around the side, and then they come together and spit out the, I guess you could call it kind of like this. So there's a hole in the middle where the spinal cord goes through, and the bones that connect to the bone in the back, where the bones that we actually can feel if we reach around and feel the tip of your spine, in front of that are these two prongs that come out on either side. Both of those bones broke in the middle of a baseball game. And so I ran out to first base, and I started feeling really tight, like something was wrong. The next pitch was a hit and run. I had to go and run and slide into second base, and I couldn't get up. It took 3 guys to pick me up, carry me back onto the bus, and I was stuck there for a week feeling like that until I could get home to see my parents. This is at like maybe 13 years old. And so I went through a year of rehab with that, and I use a lot of that rehab in today's practice, right, in my clinic today. And it's so beneficial that it stayed with me for 25 years at least. And it's just been a really cool ride. So it started with the fracture. It moved into core retraining and stabilization, kind of like resetting what my body was going to do. Then I had to rewire everything, and ultimately I was able to restore it with the icing on the cake when it came to chiropractic, the brain-based adjusting, as well as non-surgical spinal decompression, laser therapy, pulsed EMF therapy, and things like vagal nerve stimulation. So what we're doing for patients is not so dissimilar, right? We're doing very much similar things, but each patient is a little bit different. Each patient comes in, we do a full neurological evaluation. We measure their eyes because the eyes are the only sensory organ that allow me to measure the entire brain. Front of the brain, back of the brain, sides of the brain, brainstem, cerebellum, and vestibular system. And those last two, the vestibular system and cerebellum, all control our spinal muscle tone and the tone and stability of our shoulder and hip girdles. So everything else kind of coordinates within that, but those are the most important things that we look at when we look at neurological stability. If there's any instability or movement of the eyes or shaking of the eyes or oscillations of the eyes, then we know for sure that that person's going to have an unstable spine. So it's not really surprising when I run a test and I look at this and their eyes are just a mess and they hand me an MRI and they show me significant degeneration, disc bulges, disc herniations, disc protrusions, annular tears, and there was no trauma. Right? They were just bending over to pick up a shoe. I had a guy pick up, I think, a sock off the ground, and he blew his back. This is long before I became a chiropractic neurologist. This former athlete bent over and blew his low back out and had to have emergency surgery. I never evaluated him. I had no idea what was going on with the case, but things like that just blow my mind, that the spine can be so unstable that a simple picking up of a sock basically changes your life. And so my goal here at the office at Desert Brain and Spine, we use brain, body, and biochemistry as our assessment markers, right? We evaluate the neurology, we evaluate the spine, and we can get into functional medicine or nutritional and chemistry-based therapies. Then we put you through an intensive program that can last as little as 1 to 2 weeks, or as much as 3 to 6 months, depending on how bad that problem is. And each individual will get the therapies that they need. If you don't have a bulging disc, then you don't need the therapies like spinal decompression. If you have chronic pain, we have to rehab your brain. So every patient that walks in here gets some form of brain rehabilitation. And what that looks like is maybe breathing activities, head movements, eye movements, body movements, but we have to coordinate them within what you can tolerate, right? So if I give you an exercise and you're falling over, you can't tolerate that exercise. So I have to modify that until you can do that properly, right? So it's not like PT where you're just told to do the exercise and good luck with it, really. And you just keep doing the same thing over and over and over and over to just make you stronger. It's different than that because we're training the nervous system, right? The nervous system is so cool because one of the pieces of it is called the autonomic nervous system. That's where our fight or flight or our rest and digest system comes in, right? I think most people understand the fight or flight system. It's really called the sympathetic system. And so the sympathetic system or the fight or flight system is what we really have to look at in every individual. Part of our intake is looking at stress, triggers, sleep, focus, attention. All these things tell me how well certain parts of the brain are working, like the frontal lobe. The front part of the brain is ultimately the part that inhibits everything and calms everything down. So if that's weak, you're not going to be able to control your own fight or flight response. If you have a chronic fight or flight response, then you're not going to be able to digest very well because these things are inverse. So if the fight or flight or sympathetic system's high, that means rest and digesting and the parasympathetic are low. So we don't have proper blood flow to our gut. We don't have proper enzyme production. We don't have proper motility and things like that. And that's also part of our immune system. So we might have sickness, illness, autoimmune diseases, skin irritation, allergies, things like that. We might just maybe respond to viruses like maybe COVID or mono, EBV, CMV, all sorts of different viral loads can really affect our system that really shouldn't, you know? And so every patient that comes in, whether you have chronic pain from neuropathy in the feet, whether the neuropathy is from diabetes or from the spine, we will figure it out because we look at brain, body, and biochemistry, right? The biochemistry looks at the diabetes and can help to support that. The spine or the body looks at spine and the structures of the feet. Then we look at brain and how the brain controls blood flow, controls the immune system, the nervous system, and that autonomic system so that we can get all the blood flow to the areas that we need. So we can keep the system decreasing inflammation naturally, and that we move properly through each joint based on the neurological function and timing, right? So our testing is looking at the eyes, then we look at the balance and move our head around so that we know if your neck is involved and how well you basically adapt to different perturbations or movements within that balance system. And then the last thing we test is coordination testing. Timing and coordination is very vital to your existence, right? Not only are we looking at timing of physical movements, right? Like gait, tapping different things on the screen to make sure that we're on time, touching our nose with our eyes closed, maybe standing on one foot and holding our balance so our body knows where we are in space. But the same timing mechanism and coordination mechanism deals with our thoughts, right? What do we think about? Are we able to go to sleep, or is our mind racing? Do we wake up with our mind racing? Do we have any depression, anxiety, right? Do we have focus and attention issues that we're thinking about the wrong thing when we should be focusing elsewhere? All of these thoughts, all of these applications or symptoms, I guess you could call it, that we look at are almost always able to reduce, resolve, or completely restore their function in the areas of the brain, the body, and that biochemistry. Now, we do work with other doctors in the Valley here as well as across the U.S. because we do have people that fly in, right? So like I said, we can deal with these things from a week or two or like a 3 to 6 month program. And we've had everybody in between where somebody comes in and they have a significant issue. They might actually fly in from out of town and we work on their brain for 1 to 2 weeks at a time, and then they fly back more stable than they were when they came here. Now, is that designed to completely fix someone? Not necessarily. Depends on what the problem is. Usually those cases that fly in for 2 weeks at a time are cases like a concussion or post-concussion syndrome, vertigo and dizziness issues, migraine problems, usually those are from head injuries, and then things like dysautonomia, right? So dysautonomia is when that fight or flight and rest and digest system is so far out of whack that the person cannot get proper blood flow anywhere. And that blood flow change tends to show up like brain fog, inability to focus and attend, chronic fatigue, eye symptoms, headaches, dizziness, and insomnia. Those are the most common problems with dysautonomia. And honestly, anxiety is even one of those. So anxiety, in my opinion, is a lesser form of dysautonomia, but the anxiety, depending on the intensity of it, can create all of those other problems, right? You ever had a trigger of anxiety that kicks in for no particular reason? All of a sudden you get lightheaded, you get sweaty, you get dizzy, you get brain foggy, and then you can't think straight. Right? You might even get a headache or have like a body part go numb, or you just get real fatigued all of a sudden. These are some of the most common symptoms dealing with head injury, dysautonomia, and anxiety. And so we see a ton of that here in the office. So those would be good cases to do over the course of like 2 to 3 weeks. We call it that like an intensive or a modified intensive. So we get like 3 months worth of work done in a very short amount of time. Okay, so that would be like multiple visits a day, just hammering away to try to create some stability. Now, those cases we typically recommend more when it's very specifically the neurological pathways that are broken or that are weak. The cases that tend to involve more, let's say, psychology or thinking and thought process stuff, those are going to be more recommended towards a long-term program. It's like a 2 to 3 month program. That allows us to make changes and repetition on a day-to-day basis so that we recreate new habits and break old ones. The cases that are going to take the longest are usually the cases that have both pathway issues, which would be brain-based issues, structural issues like, say, disc bulges and chronic pain for, say, 10 to 15 years, and on top of that, they have some chemical or, say, inflammatory issues. So let me give you an example of the last one. We had a patient actually call in here after their friend was treated for a concussion, had a really good response, so they referred her friend in. And so this friend comes in from Seattle. They actually flew here and stayed here for 3 months' time. And we were able to rehabilitate her disc because she had chronic pain and nobody had addressed the disc or the health of the disc. And nobody had addressed the neurology, right? This person dealt with chronic pain and went to all these different specialists and kept wondering why nobody was looking at her brain. Brain is a source of chronic suffering. That's the only place it happens. The body is designed to heal these issues. If it's not healing, we have to get the body in a place where it can heal. So pain fires that fight or flight system. If that fight or flight system is so chronic that you can't rest and digest, well, part of the resting and digesting is the repair phase. So if we can't get into a more balanced autonomic system, then we're never going to be able to repair. So if we can do that, then we can heal these disc injuries. We can heal neuropathy. We can heal migraines. We can heal vertigo. We can heal all sorts of different things. And when I say heal, what I mean is we put the whole system together and we address the problems that we can see and we can handle. As a chiropractor, I have to be very careful what I say I can heal or treat. What I know is we work extremely well and have had amazing results with disc bulges, disc herniations, neuropathies, balance issues, vertigo, dizziness, anxiety, migraines, visual tracking issues, learning disabilities like ADHD and dyslexia, as well as adult focus issues, chronic fatigue. We even work with athletes to optimize their performance, and even high-achieving CEOs and performers in the job position. And so really, if nobody's looking at your brain, I would caution you to maybe find a doctor that will, or give us a call to see what we can do for you, either in the office or with some of our online training programs to just get that brain stronger. Okay? So anyway, this was kind of my story. I know it was kind of all over the place, but I really love telling my story and how I got to where I am today so that ultimately I can try to help more people. And we also have a surprise coming soon. We will be bringing a new doctor on in 2024 to be able to help even more people. And I'm so excited for some of these changes for you guys. All right. Well, this is Dr. Teams again with the NeuroRESET podcast. We'll see you next time.